It would certainly make sense based on the science that the first step would be opening to fully vaccinated travelers, given that so far people who are fully vaccinated appear to be much less likely to become infected or spread the virus.
Canadian epidemiologists say plans to reopen Canada to fully vaccinated non-essential travelers look good, but there's no way to eliminate risk entirely. Speaking to 680 News, Dr. Isaac Bagosh says the first step of opening to fully vaccinated Americans seems reasonable.
I think it's fair to say that there's always risks involved, and we can't ignore that. On the other hand, currently in Canada, the burden of COVID-19 is very low. The pace of vaccination or the rollout of vaccine is very high, and the healthcare capacity is obviously much, much better than it was in the midst of our third wave, or when we were coming out of our third wave. So, yeah, it's certainly a lot better now. And, you know, if we take this policy at face value, allowing fully vaccinated individuals to enter the country, yeah, it's about as safe as it gets.
A majority of Canadians seem to agree. A new poll from Leger and the Association of Canadian Studies shows around 66% of Canadians agree travelers should be fully vaccinated when entering our country. This as other countries which have begun to loosen restrictions see case spikes. The United Kingdom opened up on Monday and is now seeing a wave which is on track to send infection rates higher than ever. Bagosh says a fourth wave in Canada is inevitable, but with vaccines is manageable.
It's happening basically everywhere else in the world that's reopening. We're not unique. So the key here is how big is that rise in cases going to be? And, what is the burden that's going to place on the healthcare system? And sadly, what are the outcomes? Like, how many people are actually going to die from this?
Canada's opening to non-essential international travel is limited, however, to people vaccinated with Health Canada-approved vaccines. Epidemiologist Cynthia Carr says this cautious approach is the right move. While other vaccines may work and may be safe, Health Canada needs to make that determination for Canadians.
The effectiveness of different vaccines can vary, and I don't know off the top of my head of the effectiveness of all of the vaccines that are not available in Canada in terms of holding strong against the spread of all of the versions or variants of the virus, as well as keeping people safe in terms of the worst case outcomes of severe COVID and death.
In Ottawa, Xiaoli Li, City News.
Happening